Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear students, today's topic is DNS and its treatment. Well, we have already talked about the deviations of the nasal septum, the types, but now today I'm going to talk about its treatment. Now, a lot of people, even a lot of people among you, must be suffering from a deviated nasal septum. So one must know what sort of treatment is available for such a common problem. And the treatment options are usually SMR or a septoplasty. Now, what's the difference between an SMR and a septoplasty? SMR is also called submucous resection of the nasal septum, where septoplasty is a relatively recent procedure which implies removal of cartilage as and when needed from the septum. And while SMR, submucous resection, was a classical approach to the treatment of DNS in the old days, and in that kind of approach, people removed a lot of septal cartilage as well as the vomer bone and the perpendicular plate of the ethmoid bone, which later on resulted in a saddle nose deformity as well as a lot of complications. So let's just talk about SMR and septoplasty in a little detail. Bismillahir Rahmanir Rahim. Today we are talking about complications of septal surgery. Well, complications of septal surgery can be summarized in this form. Well, one can have hemorrhage, one can have septal hematoma, one can have septal abscess, one can have septal perforation, a saddle nose deformity, or columellar retraction, flapping septum, persistent deviation, nasal synecdoche, CSF rhinorrhea, infection, and toxic shock syndrome. Well, while we are going to talk about complications of septal surgery under certain headings, well, like septal hematoma and septal abscess and septal perforation, these other kind of complications like hemorrhage can be due to elevated blood pressure or sometimes an aberrant blood vessel being cut during septal surgery. Now, talking about saddle nose deformity, well, one can remove a lot of septal cartilage during septal surgery, which then removes the support of the septum, and the nasal bridge may come down or have a saddle in it. Or one can have a supratip saddle deformity or a supratip depression. Columellar retraction can also occur because of taking a lot of caudal end of the septal cartilage out and removing the support from the septum. So, columellar retraction, the columella may be indrawn towards the nasal cavity. Flapping septum, this is a complication because of removal of lot of septal support, like removal of the cartilage of the septum to a great extent, plus removing the vomer and perpendicular plate of ethmoid bone, which gives rise to flapping septum. And flapping septum means while the patient breathes, the two mucosal folds on either side of the nasal cavity have no bony or cartilaginous support, so it just flaps from side to side. Whereas persistent deviation can also occur in cases of septoplasty or SMR because of the correction had not addressed or wasn't possible to remove that part of the cartilaginous or bony deviation. Nasal synecdoche are usually adhesions, fibrous adhesions, which form due to a lot of trauma occurring inside the nasal cavity. And that trauma later on leads to development of fibrous tissue or fibrous bends between the medial and the lateral wall of the nasal cavity. CSF rhinorrhea can also occur because of removal of the perpendicular plate of ethmoid bone, which can fracture the cribriform plate, and CSF may run out through the cribriform plate into the nasal cavity and come out through the nostrils. Infections later on can also complicate septal surgery in the form of rhinitis, middle ear infections through the eustachian tube, nasopharyngitis, pharyngitis, sinusitis, tonsillitis, laryngeal infections like laryngitis, and so on. Whereas toxic shock syndrome is again because of the anesthesia and lot of infections and trauma to the nose. Now we come to specific complication like septal hematoma. It's a collection of blood under perichondrium and periosteum of nasal septum. Its etiology is usually nasal trauma, be it a fall or an accident, a road traffic accident, or it could be due to septal surgery like septoplasty or SMR. And it can also occur without any perceptible trauma in patients who have got bleeding disorders like hemophilia. Now what it looks like is a dumbbell-shaped swelling and in both nasal cavities on both sides of the nasal septum. It's compressible and one can check it with a probe. Its clinical features usually bilateral nasal obstruction, by which a patient comes to see the doctor, where sense of pressure over nasal bridge. This bilateral is smooth, rounded septal swelling. Also, it could be a dumbbell-shaped swelling. On palpation, the mass is soft and fluctuant, whereas there is absence of raised temperature. There's absence of redness sometimes, and the swelling and tenderness is also not there over the skin of the nose. Well, complications of a septal hematoma itself can be in the form of when the hematoma is resolved on its own, then it can lead to a thickened nasal septum. Whereas a hematoma getting infected can lead to, in turn, a septal abscess formation with cartilage necrosis. Whereas a saddle nose deformity again, because of cartilage necrosis, can occur. Suppurative deformity or depression, again due to cartilage necrosis. And a septal perforation can also occur in the end. Now before we talk about septal abscess, this is another kind of complication. Septal hematoma, how we deal with it. The treatment of septal hematoma is to drain it immediately. If possible, one tries to do it with a wide bore needle. Wide bore needle, just suck it out and then pack the nasal cavity on both sides with a anterior nasal packing, half-inch ribbon gauze impregnated with BIP. And this pressure is kept for a day too, when the hematoma is again visualized, and if it still needs a packing, we pack the nose on both sides for a day again. So that is the sort of treatment with septal hematoma, that it needs to be drained properly and in time. Now, if the septal hematoma cannot be drained with a wide bore needle, then one has to drain it with a small incision on the septum. And that incision is usually made on the lower part of the swelling, so that dependent drainage can also occur later on. And that hematoma with a small incision on the septum can drain it, and then later on the nose is packed on both sides in the same way as after a drainage with a syringe. Now, we come to septal abscess. It's a collection of pus under perichondrium and periosteum of nasal septum. Its etiology is that secondary infection of a septal hematoma can lead to a septal abscess formation, whereas following a furuncle of nose or upper lip, it can spread to the nasal septum, and collection of pus can occur between the nasal mucoperichondria and mucoperiosteum, and forming a dumbbell shape of swelling in both sides of nasal cavity. Whereas following typhoid or measles, complication may occur with septal abscess as well. Looking at this photo of a patient with a swelling on the nasal septum in the left side, that is pale color, and the swelling underneath, there is pus collection. This is septal abscess. Now, septal abscess can also be seen on a CT scan in this photograph, and this septal abscess is involving not only the anterior part of the septum, but up to the septal cartilage extent in the nasal cavities on both sides. Clinical features of a septal abscess: bilateral nasal obstruction with fever. Skin over nose shows raised temperature, erythema, swelling and tenderness. Versus bilateral smooth, soft, fluctuant septal swelling is there. And septal mucosa is congested. And there may be submandibular node enlargement and tenderness. Treatment of a septal abscess: well, abscess is drained immediately, because there is a rule, wherever there is pus, it must be drained. So abscess is drained immediately. Incision is made on most dependent part of the nasal septum having this abscess, with pus and necrosed cartilage removed. And nasal packing is done with a half-inch ribbon gauze nasal pack impregnated with BIP, or if the BIP is not available, then any antibiotic ointment is applied on the nasal packing, and the nose is packed on both sides. Systemic antibiotics given for about 10 days. Complications of a septal abscess can be necrosis of septal cartilage, because the blood supply to the cartilage or the nourishment, because the cartilage has no blood supply, the nourishment to the cartilage has been removed because of the collection of pus, because the cartilage is nourished by the mucosa overlying it. So when the mucosa is separated from the cartilage itself by the abscess, then it can cause necrosis of septal cartilage. Whereas saddle nose deformity again because of septal cartilage necrosis and a supra-tip deformity can also occur. Whereas septal perforation because a lot of degeneration and necrosis of septal cartilage can in turn lead to infection of the mucosa and through and through perforation may occur. Whereas meningitis, because of spread of infection intracranially, and cavernous sinus thrombosis can also occur because of this. Now we come to our next topic, and that is perforations of the nasal septum. A septum can be perforated because of trauma, first of all, and that trauma is usually septal surgery or sometimes nose picking. When a patient is used to picking the nose, sometimes nail trauma can lead to wound formation. Later on, it develops into a perforation of the septum. Where septal cautery can lead to perforation of the nasal septum. Sometimes ornamentation, like some people wear rings through the nasal septum, and that can get involved and infected and lead to a perforation. Infections like septal abscess, we just talked about earlier, can lead to perforated nasal septum. Whereas nasal irritants like snuff and cocaine, sniffing, can also irritate the mucosa, and patient tries to scratch it every now and again and can lead to perforation of the nasal septum. Whereas foreign body, like a rhinolith, which is a stone formation inside the nasal cavity, or nasal myiasis, which is infestation of the nasal cavity with larvae. It's also called maggots in the nose. Granuloma formation inside the nasal cavity, like tuberculous granuloma or tuberculosis or leprosy or syphilis or venous granulomatosis, can all lead to a nasal perforation in the septum. Whereas malignancy, like tumors of the nose, squamous cell carcinoma, for example, or rodent ulcer, they can lead to a perforation of the nasal septum. Idiopathic, where no known cause is there, then we can have septal perforations without any cause. Now, clinical features of a perforated nasal septum: one can have a small perforation, and because that is small perforation, air entering the nasal cavity can cause whistling sound during respiration. Whereas if it's a large perforation in the nasal septum, then it can lead to infections, nasal crusting, and nasal obstruction, and sometimes epistaxis on crust removal. Treatment of perforation of the nasal septum, one can talk about in a nutshell: all surgical procedures aimed at repair of nasal septal perforations are based on two main principles, namely repair using mucosal, mucoperichondrial, and or mucoperiosteal flaps from the nasal cavity, or with connective tissue autografts to be interposed between the mucosal flaps. Sometimes this sort of treatment works, at other times it may be a failure. Thank you. Thank you very much.